New Jersey is a leader in the nation in reforming our Medicaid program. Last year, the federal government approved our innovative and strategic reform proposal, which does right by the people the program is designed to serve. We have taken groundbreaking steps to ensure high-quality, cost-effective, and comprehensive health care for New Jerseyans by focusing on controlling costs, promoting community-based care, preserving hospital funding, and integrating primary and behavioral health care. For example, as a result of our reforms approved by the Obama administration, instead of having the standard Medicaid program that forces seniors into nursing homes as the only option when they need long-term care, our seniors will now have a choice. They'll be able to stay in their homes, in their communities, while still receiving the services, care, and support that they need. It's simple. We're putting people first, which is why, after considerable discussion and research, I have decided to participate in Medicaid expansion under the Affordable Care Act. While we already have one of the most expansive and generous Medicaid programs in the nation, including the second highest eligibility rate for children, we have an opportunity to ensure that even greater number of New Jerseyans who are at or near the poverty line will have access to critical health services beginning in January of 2014. For a single adult, 133% of the poverty level is under $16,000 a year. These folks are consistently among those who need help the most. Men and women who have suffered trauma in their lives, live with mental illness, rely on New Jersey's emergency rooms for primary health care, or those citizens who lack insurance or access to treatment in other ways. Expanding Medicaid will ensure New Jersey taxpayers that they will see their dollars maximized. Federal funding will cover 100% of the cost of this expansion for the first 3 years, and then leveling off to 90% in 2020. Now, let me be clear. Refusing these federal dollars would not mean they wouldn't be spent. It just means that they would be spent to expand health care access in New York or Connecticut or Ohio or somewhere else. Now, accepting these federal resources will provide health insurance to tens of thousands of low-income New Jerseyans, help keep our hospitals financially healthy, and actually save money for New Jersey taxpayers. In fact, taxpayers will save approximately $227 million in fiscal year 2014 alone. Now, let me also be clear. I am no fan of the Affordable Care Act. I think it's wrong for New Jersey, and I think it's wrong for America. I fought against it and believe in the long run it will not achieve what it promises. However, it is now the law of the land. And I will make all my judgments as governor based on what I believe is best for New Jersey. That's why I twice vetoed saddling our taxpayers with the untold burden of establishing health exchanges. But in this instance, expanding Medicaid by 104,000 citizens in a program that already serves 1.4 million is the smart thing to do for our fiscal and public health. Now, if that ever changes because of adverse actions by the Obama administration or broken promises, I will end it as quickly as I started it. See, because even without the Affordable Care Act, we have continued to work to provide health care to the uninsured, including many thousands of low-income children through New Jersey Family Care. This budget continues that effort by providing a $47 million increase for family care. And our commitment to prevention in health care extends beyond Medicaid. It is across the board.